Hi. I feel like this is the gathering of the tribe, you know? If you identify yourself as either a patient activist, or a patient or advocate, can you please stand up? Look around in there too. Ladies and gentlemen, these are the blockbuster drugs. I swear to you, these are them. I take very seriously, and it weighs heavily on me to be the token blockbuster pill today. But I'm going to do my best for you here. I received my first cancer diagnosis on my 20th birthday, and spent the next month in intensive care as the doctors tried to halt the galloping course of the disease through my body. I was just distraught. I can't die yet. I'm just starting out, you know? When I left the hospital, I went through 2 grueling months of daily radiation, followed by 2 grueling years of chemotherapy. I was skinny, I was bald, and I was non-compliant. You know, my doctor would go over my oral chemotherapy regimen very carefully, and I would sometimes do it, sometimes, often, but not always. My doctor would tell me that I had no immune system and I mustn't leave the house. I would go dancing. You know, given my bad behavior, it's amazing that I'm still here. It's probably even more amazing given my 3 subsequent cancer diagnoses, the most recent of which, stomach cancer, I wrote about in my essay in this issue of Health Affairs. I live every day with the effects of that many diagnoses and that much treatment. I'm a frequent, though not enthusiastic, user of healthcare services, and I have many opportunities to be amazed at how advances in healthcare promise faster cures and better outcomes at the same time they shift responsibility onto us and those we love and who care for us. I'm going to have a slide change here at some point, and I need to make sure I've got this thing. Okay, right. So today, rather than recap my essay, I thought I'd pull out 3 themes that I think are important for all of us to think about in light of the papers that we've heard about so far and that we'll hear about for the rest of the day. First, engagement is not a nice thing that we do if we have a little extra time and access to broadband. It's necessary if we are going to find and make the best use of the care available to us. Years after my first cancer diagnosis, it hit me. Millions and millions of dollars worth of research were being distilled into services and technologies and procedures and drugs that were taking many thousands and thousands of dollars to deliver. And the success of that whole effort depended on the participation of a weak, skinny, scared adolescent to have its effect. If I didn't, make the appointments, show up for the radiation, take the drugs for the chemotherapy, get the tests, report the symptoms, and just soldier on there, this would all fail to have an effect on my cancer. That investment of time and money would have been squandered. I, of course, would have suffered the most, but the effects of my non-participation would reverberate throughout other stakeholders as well. So while I'm truly, truly grateful for the health professionals who wield the tools of medicine to make it possible for me to be here today, I am also keenly aware of my own role in the outcomes of my treatments. I have been profoundly challenged, I have to say, by the need to be an engaged patient. It's so hard. I can't tell you. Well, I wrote about how hard it was actually in my piece. But I keep thinking, if this is so hard for me, what must it be like for people who know less and who have less? As our active and knowledgeable participation in our care has become so necessary to the success of that care, it means that those who are unable to engage, those who are already ill, who are cognitively impaired, who are alone, who lack the literacy skills or the resources, those people will suffer disproportionately. There is no auxiliary backup system for them. My second insight is that engagement doesn't mean compliance. While I was not following my doctor's orders, following my diagnosis of Hodgkin's disease, I was engaged in my care. Absolutely. I was terrified I was going to die, and I would do anything to stay alive. But, you know, this was in the early 70s, and there were no anti-emetic drugs. So if I were to take my pills as prescribed, it meant that I threw up every 15 minutes for 48 hours, twice a month. You cannot imagine. And I was a teenager. I hadn't had one hint of normalcy. No music, no friends, nothing, for months and months. How could a little dancing hurt? It's not like I was slow dancing or anything, you know. So I was engaged, but I wasn't compliant. And you can understand, right? Of course. The mistaken notion that our engagement in our care means that we're just compliant with our doctor's orders is based on an idea that our only identity is as a patient and our only responsibility is to do what our doctor says. You know, all of us want to feel better, but our lives are filled with many real competing demands. We constantly weigh the responsibility of caring for ourselves against the demands of our lives and our available time and energy. We got to pick up the kids, we got to walk the dog, we got to call our mom, we got to go to a meeting, we got to fix the truck. That stuff competes all the time. Can I do this? Can I take the pills? Can I walk around the block? Can I manage to do these self-care tasks? True engagement means that we have the knowledge and skills to make judicious trade-offs regarding the care that meets our needs and our preferences. We need to know about our condition, enough about it to be able to set priorities among all the things we have to do. We have to be able to work with our clinician to set up a realistic care plan that gives us choices, that is matched with our abilities, and that gives us a chance to succeed. And then we need to be able to modify that care plan over time as our health ebbs and flows. The papers in this issue of Health Affairs explore the policies and programs that are going to make that possible in the future to enable us to do these things. My third insight is that our actions matter. After my third cancer diagnosis, I was really disturbed by how much I had been expected to know and do in order to get good care. So in 2007, the Center for Advancing Health, which I direct, launched an initiative to nail down a behavioral definition of patient engagement. First, we got some great advice from veteran quality improvement expert Shoshana Sofair, who said that the quality improvement movement really didn't get much traction until it focused on the specific behaviors that led to better outcomes. So taking a page from that book, we defined engagement as actions we take for our health and to benefit from our care. We interviewed over 200 people about what they did to find good care and make the most of it. After a long iterative process, we identified 43 behaviors, 43, that's a lot, that fall into these 10 categories. They'll look familiar to you. The good news is that no one has to do all these 43 behaviors at once. The bad news is that all of us have to do them at some point, or our caregivers have to do them, if we really are going to get the most from our care. The papers in this issue of Health Affairs discuss the psychological, social, and practical determinants and antecedents of these behaviors. They explore how to facilitate these behaviors, how to prepare us psychologically to do them, how to remove the barriers we face to doing these behaviors so that we can achieve better outcomes. From our perspective, though, it's our actions on behalf of ourselves and those we love that make a difference. We have to find the right doctor. We have to get the test. We have to negotiate the treatment plan, take the pills, walk around the block, lose the weight. These are actions that only we can take, consistent with our preferences, to reduce our risks and ensure that we get the best possible outcomes. I'm so grateful for Susan Denser's leadership in identifying patient engagement as a critical aspect of the success of the healthcare enterprise. I am delighted that the sponsors have chosen to shine their bright light on the issue of patient engagement for this issue of health affairs and for their other patient engagement initiatives. And I deeply, deeply appreciate the creativity and the scholarship of my brilliant colleagues, Judy and Kristen, and the other nearly 60 authors who contributed to this journal. You are laying the groundwork that gives the field of patient engagement the legitimacy and the scientific support that it must have to serve as the basis of changes in policy and practice. Because, it's going to take a lot of heat and a lot of light and a tremendous amount of commitment to make sure that all of us can engage fully in our care. That is, so that each one of us, you and your mom and your kids and your neighbors and all those people on the metro this morning, all of us can act to make use of the tools of healthcare to reach the aim that we all share, and that is to live as well as we can for as long as we can. Thank you.